next, we have Mike Wessinger, who's the founder and CEO of PointClickCare, which is Canada's largest private software company and industry-leading innovator in the effort to solve the global challenge of senior healthcare. Welcome, Mike. Thank you so much for being here. I'll let you share your screen and I'll hang out here for a moment to make sure everything's working properly.
Okay, thank you. I appreciate it. Yeah, in the introduction, so PointClickCare, we provide the sort of the backbone that runs long-term post-acute care organizations. So that would be think nursing homes, assisted living, in addition to home health. It was great listening to Adrian. So many parallels in the things that we're seeing, the impact of COVID on technology. I want to talk a little bit about just one thing that in recent events with racial equality at PointClickCare. One of the things that we chose to do as an organization is wanted to start off with just by listening, and so we found a way to engage with our staff, meet in group settings where we have breakout groups, and really try and understand what the biggest issues are, so that we don't just go through a checklist and wind up with something that is a one and done, and then we'll ignore it until the next big event. We really wanted to be able to put together a roadmap and do something sustainable. And we got a head of diversity and inclusion that's going to help us work through and develop a full roadmap to deal with making sure that at PointClickCare we really focus on racial equality and diversity. So the impact of COVID on healthcare, one of the things that we've seen as the stressors in long-term post-acute care is that we know that within the next 3 years, we're going to see the silver tsunami hit the healthcare system. So a lot of people think that today the boomer demographic is already hitting the healthcare system. And the reality is the long-term and post-acute care markets don't care about 75 or 80 year-olds. The average age that people start to consume long-term and post-acute care services is 83. And that demographic has been flat for the last 10 years, and that's because during the Depression nobody was having kids. So that demographic hit rock bottom last year and starts to tick up this year, and that means in about 3 years from now, the wave of demand for long-term and post-acute care is going to hit the system dramatically. And if we don't fundamentally change the way that we deliver care, we're going to bankrupt every healthcare system around the world. So what was interesting is two of the things that we've been looking at for the last few years is telehealth, remote monitoring, and informal care as really things that were going to be critical when the system hits the stressor of volume hitting. Well, COVID-19 was that stressor that hit the system. And sure enough, those two things became the most popular solutions, certainly within our customer base. And we've got about 70% of all the long-term care facilities across North America utilize our solutions to run their business. And when you look at it, when the stressor hits the system and you've got people who aren't showing up for shifts and you have to move to a low touch model, the only way you're going to solve that problem is with telehealth and remote monitoring, really finding ways where you can take a single caregiver and you can leverage them across a larger number of residents or patients that you need to care for. And then having the ability to monitor those patients without having human beings required to do that 24/7. So that COVID really provided an early warning system to say, hey, we need more telehealth and remote monitoring. And we're going to start to see funding models and people's general acceptance of how it is they think about telehealth. And hopefully that changes for the long term. This isn't just a flash in the pan. I think now people are starting to come to the recognition that there's technologies available to allow people to don't have to physically go and connect with a caregiver in order to receive care. Now, that's not going to solve 100% of the problem because there's just so much of healthcare that is one person doing a verb to another, especially in long-term care, eating, toileting, transferring, dressing, all of those things. Informal care is the other one, which is Adrian talked a little bit about this, is taking that highly motivated friends and family caregiver that are untrained and unskilled, but very motivated to care for their loved ones. And when you're dealing with in the world that Adrian and I do, which is an aging population, it's very important that you can take that whole workforce of people that are highly motivated and get them engaged in the care for the loved ones. We saw that during COVID, the ability for caregivers to be able to update friends and family members without having to physically create another call, to be able to have that driven directly from the care that's being documented, and getting them involved in things like social isolation and using technologies to do that. So those are incredibly important things that are going to be that helped during COVID, that I think are also going to be important when the silver tsunami hits the system. And these two things, a lot of what is required for that, when you've got an environment where you've got a congregate setting and you've got to start keeping people separated, some of these technologies that create lower touch for caregivers, lower touch for individual themselves, and less volume and traffic in these settings, I think is critical. A lot of people think that that this pandemic could have been avoided if we could avoid the long-term care settings. The reality is, when you've got a congregate setting where you've got people who are the most frail in our population living in that congregate setting, and you've got staff that move around from building to building, you've really sort of created a Venn diagram of the most difficult place to try and manage those infections. And it would be certainly, if we could move these people so they could go home, it'd be far easier to manage the spread of infection. But the reality is, most of the people are in long-term care or skilled nursing facilities, not because they choose to be there. In fact, the next time I hear someone say they want to be in a nursing home will be likely the first time I hear it. It's because they have to be there. If they've got 5 or 6 comorbidities, the ability to care for them at home is, getting 24-hour care at home is not cheaper than in a congregate setting. So we got to figure out ways to be able to, to manage the spread of infection in those environments. And I think what COVID really teased out is really the need for all of healthcare to push towards digitization. There was just far too many decisions that were being made in the absence of information. There wasn't enough information to be able to do predictive analytics and artificial intelligence on, which meant that people were making decisions with gut instinct and using blunt instruments like shutting down the entire economy in order to solve the problem. When if with the right data, you could be far more surgical in your approach to how it is you manage pandemics and infections. The other one is interoperability. I think what it brought to the forefront is there's so little information that gets transferred between different care settings, whether it's between home health and long-term care, hospitals and family physicians. There really is very, very little interoperability. And I think this is one of the areas I think that will surface after this pandemic is over, as an area that that we as a society need to invest to make sure that we can get the transfer of information between different care settings. And I think that the third one that's come out of this is the ability, if you've got more of a digitization of the healthcare record, more interoperability, is just the ability to put a system-wide infection surveillance monitoring in place, where you not only look at where you've got the hotspots for spread of infections in a real-time basis, but where you're likely to have those with using AI and machine learning to take all of that data, instead of shutting down an entire economy, going, hey, where do we need to put a fence around? Where do we need to be more stringent and rigid with our infection prevention measures and control measures, and what areas can we leave largely untouched? So I think that pandemic is really while the outcomes and the number of deaths and are bad, I think what will come out of this is that increased need for digitization, remote care technology, and really the engagement of the informal caregiver.